We're joined now by Dr. Richard Kovacs from the American College of Cardiology to talk more about this horrifying incident. Dr. Kovacs, what do you think happened to Damar Hamlin out on that field?
Well, what we know for sure is that he had a cardiac arrest and that he had a restoration of heart rhythm. There's a great deal of speculation as to what happened. It may have been related to a blow to the chest, which is a medical condition we call commotio cordis. But that's speculation, and we don't know that for sure.
How serious is this, and how long typically is recovery for someone who experiences this?
Well, cardiac arrest is as serious as it gets. You have minutes to respond. Typically, we don't know for sure in terms of recovery for the first 24 hours in a patient who suffered cardiac arrest, though. In the first 24 hours, the typical protocol would be to support the patient, to sedate the patient, and often to cool the patient. The whole body is cooled to protect brain function during this critical healing time. So typically the first 24 hours is a period of watchful waiting, a very difficult period.
Well, this was obviously a shocking scene for many watching last night. Is there any way of preventing something like this again in football? And how common is this type of injury?
I've worked with the NFL for many years. I screen the players for cardiovascular abnormalities at the scouting combine every year for the last 20 years. So leagues try very hard to identify any high-risk features for their players that might put them at risk for cardiac arrest. But what we saw last night, that even with the best of circumstances, that a cardiac arrest can occur. And when it occurs, despite the best of screening, whether that's physical examinations, electrocardiograms, or other cardiac testing, when that occurs, you need to have an emergency action plan to resuscitate the patient and, most importantly, bring an automatic external defibrillator to the patient. And we saw that play out last night. That's a very, very important, probably the most important lesson that everybody who watched last night should now know, is that AEDs are crucial to help patients survive a cardiac arrest. These injuries are quite uncommon. They're very uncommon in American-style football. We actually see these more often happen in sports where there's a small projectile that can hit the chest. Hockey on your side of the border, baseball on both sides of the border, and lacrosse. I've seen this also happen in martial arts, where a kick to the solar plexus, as we call it, can result in a cardiac arrest. The exact numbers are hard to pinned down because some of these go unrecognized.
Thank you so much for joining us, Dr. Richard Kovacs from the American College of Cardiology.
Thank you for having me.